So my name is Raisa Wheeler. I'm a paramedic for Mount Hope Fire Department. Today we're going to talk about bronchospasms. Bronchospasms are most commonly caused by asthma, chronic bronchitis, and emphysema. With bronchospasms, you'll have respiratory distress, and those are categorized in three different ways: minimum, moderate, and severe. So with minimum distress, you're going to have slight increased work of breathing with no wheezing or stridor. With moderate distress, you're going to have considerable increased work of breathing with wheezing and/or abnormal breath sounds. And with severe distress, you're going to have an extensive work of breathing, so you'll see retractions, you could have decreased lung sounds, and your patient may have an inability to speak in full sentences, and/or they might have lethargy. So the first thing that you want to do when you have a patient is you want to make sure that you're going to have your BSI, so we're going to put on our gloves. We want to make sure that we introduce ourselves to our patient. Hi, how are you? What's your name?
Hi, I'm Mariah.
Okay, and can you tell me why I'm here today?
I'm just having some difficulty breathing. I have asthma and I think it's acting up on me.
Okay, so with our patient, we want to make sure that we're identifying our right protocol. We want to make sure that our patient can use the nebulizer appropriately. So if they're too tired and they can't hold it, that's not going to work, and we'll have to use a different route. We want to make sure that we are checking our 5 rights before we give any patient any type of medication. So that's your right patient, your right dose, the right medicine, the right route, and the right time. If you're having moderate distress and you have a heart rate less than 130, you want to do your albuterol. You're going to need 5 milligrams of albuterol with Atrovent, and that creates your duoneb. Your Atrovent dose is 0.5 milligrams. You're going to have your oxygen at 8 to 10 liters per minute. And if Atrovent is contraindicated, then you're just going to do the albuterol. So this comes in a couple of different ways. We have a duoneb, and that is your 0.5 milligrams of Atrovent and your 2.5 milligrams of albuterol. With this, because we need 5, we're going to need a secondary packet of just albuterol for the 2.5 milligrams to make that 5 of albuterol. If they're separate, then you'll need 2 of the 2.5 albuterol and 1 of the 0.5 Atrovent, and this creates a duoneb. So we're going to set up for this albuterol treatment. We have our albuterol kit, and this is comprised of your mouthpiece, your tea tree, and this will connect your little plastic chamber, your nebulizer, and your oxygen tubing. So what we're going to do is we are going to connect our tubing to the bottom of the nebulizer and connect this side to our oxygen tank. We can have our patient hold this part or just hold it in our other hand. We want to put our medication in. So the duonebs, they come as a package together. This one just has the 0.5 milligrams and the 2.5 milligrams of albuterol. So you will need another albuterol to make it that full 5. So you can use this, or you can use 2 of your regular 2.5 milligrams of albuterol and then your 0.5 of Atrovent, and all 3 of these tubes will make your duoneb. And so what you'll do is you'll open your containers and you'll squeeze them into the chamber. And you'll put the top back on. And then you'll attach the top piece to this piece. And you'll turn on your oxygen to 8. And you want to make sure that your patient can hold it and that they know how to properly use it. So you want to make sure that you instruct your patient to put their mouth over the mouthpiece and make sure that they have a nice good seal and are taking nice deep breaths in. As you can see, the medication is aerosolized. And so there are these particulates in here. And so you want to make sure that the patient is getting all of the medication. And so as this medication starts to get used up, you just want to make sure that these little particulates get knocked down so that way the patient gets the full dose. You want to make sure that you listen to their lung sounds and monitor their vitals. If they're not getting any relief from this first treatment, you want to consider ALS and you want to expedite transport. You can call MedCom for a second dose of the treatment. And if their distress continues and the patient is less than 35 years old, has no cardiac history and no history of hypertension, you can consider 0.3 milligrams of the 1 to 1,000 dose of epinephrine with doctor's orders. If their distress is relieved with the treatment, then you're going to want to transport them and continue to monitor their vitals. If they're having severe distress, and that's going to be extended work, you can see retractions, they're not able to speak in full sentences, so that's your 2 to 3 word sentences, then you're going to want to do the same treatment. You want to monitor them closely. As long as they're not showing any signs of chest pain or cardiac distress, you can consider CPAP. If they do start showing those signs, make sure you stop the treatment and start treating them according to the protocol for the symptoms that they're exhibiting. And you can contact MedCom for any kind of further instructions. If their heart rate is greater than 130, it's still going to be the same medication. You want to make sure that this heart rate is not being caused by something other than respiratory distress. You're going to continue to monitor your patient and their vitals. If they start having chest pain or any other cardiac symptoms, make sure you stop your treatment and use the appropriate protocol for whatever signs and symptoms they're exhibiting and contact MedCom for further. And that's it.